Hello and good day. My name is Elmer Gozo, and I have my partner with me, Ms. Shakisha Lawson, to discuss statistical significance and clinical significance. Statistical significance and clinical significance are two distinct concepts. Statistical significance means that the findings are not likely due to chance. It is based on probability, p-value. If the p-value is less than the alpha, 0.05, study is considered statistically significant, and the null hypothesis is rejected. Hence, statistical significance is synonymous with mathematical significance. Meanwhile, clinical significance means that the findings are relevant in clinical practice. To determine clinical significance, researchers and clinicians use critical thinking and clinical expertise to determine if the research can be used in clinical practice. They must decide if the research results can better patient care outcomes and reduce healthcare costs. Clinically significant interventions are cost-effective and can improve clinical outcomes. They also enhance patients' quality of life. Hence, clinical significance is analogous to clinical importance. Statistical significance and clinical significance are both critical in reading research. Clinicians must know which research is appropriately interpreted and is valuable to their practice. Statistical significance helps researchers to determine the effects of interventions. However, not all statistically significant interventions may be clinically significant if the intervention is costly and results in minimal benefits. On the other hand, a non-statistically significant result may be clinically significant if the intervention improves cost effectiveness and healthcare outcomes. Thus, clinicians must determine the relevance of their research findings regardless of whether the results are statistically significant or not.
Hi, my name is Shakisha Lawson, and I'm going to go over some examples of statistical and clinical significance. So the first is an example study for statistical significance. There was a randomized controlled trial study done investigating the potential protective effects of using simvastatin compared with the placebo in patients with chronic kidney disease. So basically, the study was done to determine whether lipid-lowering therapy remains effective as renal impairment progresses. The results were, after a follow-up of 4.9 years, the occurrence of any major atherosclerotic event was reduced by 17% in the lipid-lowering group compared with the placebo group. So based on these results, one can conclude that lowering LDL cholesterol with the combination of simvastatin safely reduces the risk of any major atherosclerotic events in a wide range of patients with CKD. The second study is of clinical significance. So this was a study done on two different chemotherapy agents for cancer. So the first study estimates to increase the survival of treated patients with drug A, which is a less expensive drug. It increased the survival rate by 5 years. The second study utilizing drug B, which is a more expensive chemotherapy agent, estimated to increase the survival rate of treated patients by 5 months. So in both of these cases, the statistical test is significant because it did increase the survival rate, but drug A is more clinically significant because it increases the survival rate by 5 years and is more cost effective compared to other available chemotherapy agents. So to say something is clinically relevant, that means the intervention justifies the effects which over benefits the associated costs, harm, and the inconveniences caused to the individual for whom it is targeted. Now I'm going to go over how we will utilize these differences while we're reviewing literature. When it comes to statistical significance, we should always remember that the lower the p-value, the stronger the study. Do not rush to conclusions based off statistically significant data. We want to critically review whether or not the results actually matter and if they can be translated into clinical practice. Also, there are not any set guidelines for what is considered clinically important when it comes to clinical significance. So basically, you have to rely heavily on your subjective judgment. So your experience and knowledge are critical in helping you decide whether or not results are clinically important. That's it. Thank you. Here are our references. This concludes our presentation. Any questions?